I wanted to talk to you because you are, a psychiatrist, you are an expert in this realm. And I thought it might be a good place to start with the hypothesis around depression, the monoamine hypothesis around this chemical, or this, it's really a theory around the chemical imbalances in the brain. Can you explain what that is and how it is so pervasive and how we think about mental illness?
Yeah, so the sordid history of psychiatry's clamoring to be accepted and acknowledged as a valid medical discipline is probably more elaborate than we can get into now. But suffice it to say that, in around the 1950s, there were a number of factors that sort of came together to give birth to this theory. One of them was observations around the way that patients behaved after they were treated for tuberculosis with medications that impacted, at least theoretically, what's called the monoamine pathway in the brain. And there was an observation that there was like transient euphoria in these individuals. And that plus theoretical paper by a gentleman named Sheldkraut, plus minus some potential CIA co-opted research on psychedelics, gave birth to this opportunity for the pharmaceutical industry to leverage a really poorly baked biological concept and physiological mechanism around what might be driving different states of behavior, mood, and cognition, but in this case, specifically depression. And, what follows is the multi-billion-dollar industry of antidepressant drugs. And what happens is that in many cases, pharmaceutical science reverse engineers a theory, right? So it would be like, as my colleague David Healy says when he uses the metaphor around alcohol as, another representation of a consciousness-altering substance, right? So if we were to do a trial of 2 shots of vodka for social anxiety, and we would have the participants take either that or water, you could imagine that in an 8-week trial there would be an effect, so that the participants might come out of that trial and say, it really helped. I actually felt way calmer, and I didn't struggle with the social anxiety that cripples me every single day. But of course, we know logically that it would be an error to deduce from that those individuals have some sort of an alcohol imbalance or some sort of an ethanol deficiency, right? And we certainly know that if they were to repeatedly expose themselves to that kind of an intervention, that biochemically they'd be in a bit of a tough place if they wanted to discontinue said intervention a couple of decades later, right? So there have been many renegade psychiatrists before me, like Peter Bregan and Joanna Moncrief, who have been shouting from the rooftops about the fact that we can not call these medications by their mechanism, right? So the suggestion that this is an antidepressant in any way, that it is resolving a baseline known state of imbalance, is a fallacy. We can, alternatively, make the argument that there is a drug-based effect, okay? So not unlike alcohol, right?
Yes.
There's a drug-based effect. Now that effect may be very adaptive for you, right? So if you start Paxil and it's sedative and you've been wired for, 6 months, that may be exactly what you need. Or you have some of the stimulating effects of something like, Effexor or Prozac, that may be a perfect fit for you. What they have in common seemingly is a certain kind of blunting, right? Affective blunting, a kind of emotional blunting. And for many, to your original question, who do not have, I would argue this is all of us, but the experience to know how to sit with certain emotional states and to work with certain kinds of symptoms that are emerging, that could be highly preferable, right? So no one is suggesting that there isn't an effect. What many before me and what I've kind of collected data to support is that this effect is not resolving a problem. It's creating a new normal.
Yes.
And if you happen to like that, that would be great if there weren't public health, in my opinion, public health consequences to the freedom to choose this medical intervention.